Namaste. As we all know that second wave of COVID-19 had a devastating effect not only on the economy but also on the human lives. During peak of second wave, India has reported approximately 4 lakh cases daily, and overall during second wave, 11.6% children affected due to COVID-19 as per Hindustan Times report. So, I, Dr. Sonal Mehta, along with my colleagues Subham Sharma and Dr. Anjali Vincent, have decided to ponder on the situation. It's our privilege to welcome the Director of Indian Institute of Public Health, Gandhinagar, Gujarat, Dr. Dilip Mavlankar sir, to share his expert opinion and insights on the topic. Is India ready to vaccinate their children? Is vaccination in children safe? Is there any country which has started children vaccination with COVID vaccine?
Yeah. Thank you, Sonal, for asking this important question. As the schools are now being opened, this question becomes very important because
Yes, sir.
children intermingle with each other, may not be able to follow distancing norms and masking. So vaccination becomes very important. Now,
Yes.
as happens in all vaccines, first the new vaccines are tried in adults, and once safety is proved, they
Hmm.
are then tried in children. So this phase is going on. Several vaccines are now tried also in children, and in Western countries are already approved for
Okay.
use in children above 12 years of age.
Okay.
USA is already approved, UK is in the process, and several other European countries are also following suit.
Okay.
In India, the timeline declared by the government is roughly next month, which is in October. We should have the first uh, vaccine available for children from Zydus Cadila, which is a 3-dose vaccine intradermal through a jet injection mechanism, not a needle and syringe vaccine. That is being tried and now approved for emergency use for children, I mean, all people above the age of 12 years.
The next question is children vaccination urgent? Because WHO has said that there is no urgent need of vaccination against COVID-19 in children as schools are reopening. So, what are your views?
Yeah. So, in some sense, vaccination is, of course, needed. And especially when schools are starting, there is a chance that the virus will start circulating more through the schools. And in some countries, it has already happened, like in some parts of UK, USA. So we should get the vaccine as early as possible. But on the other hand side, we must understand this COVID disease in children is not that severe as in adults. So it is much milder disease. The chance of complication and mortality are also very less. Uh, there is only one severe complication of the disease, which is called multi-system inflammatory syndrome, which happens in few children in millions of cases. So, but that is a severe condition. So one has to be careful.
Okay.
That is why, as a first step, what is being advised is all staff of the schools, children, the teachers, the administrative staff, the attendant staff, etc., should be fully vaccinated, and
Right.
all precautions to be taken before the child vaccination becomes widely available.
Sir, we did one survey, and based on that small survey, with certain section of society, people are hesitant to get their children vaccinated against COVID-19. So, even if vaccines are available, how to reduce their fear?
Yeah. So I think people are hesitant in certain groups. I saw that survey. I must compliment the students of IIPHG for conducting this primary survey in many places where they are located and bringing out the data. So what we have to do is to try to find out which areas and which communities and which occupational groups this resistance to child vaccination is, and then do focused IEC efforts or behavior change communication efforts to convince parents that this vaccine is quite safe for children. And for that, we have to show them data as well as involve various popular personalities and popular leaders to convey the message that child vaccination for COVID is quite safe. And that will help reduce the hesitancy.
New variant of COVID are coming regularly, like now and then they are coming. So will the vaccination be effective against the new variant of COVID?
So far, whatever variants have come, we have seen that the vaccine efficiency declines somewhat, but not a whole lot. And that is why we are still promoting the same vaccines which were useful or made from the old strains. But as the strains mutate more and more, and there is a new strain which has just been reported in America and South Africa, from which it seems that it might have more what is called as immune escape. That means they are able to escape the immunity. In that case, we have to tweak the vaccine or change the vaccine so that it matches with the new variants and we still get immunity from the vaccine. And now in this modern era, the way mRNA vaccines and other vaccines are made, once the platform, which is the process by which the vaccine is made, is perfected, minor changes in the vaccine are quite easy to make. So hopefully within few months to a year, new vaccines may arrive, which will again cover the resistant viruses also.
Great, sir. What learning during adult vaccination should be used when the COVID-19 vaccination are open for children?
Yeah. So I think the adult vaccination, there were several lessons which were learned. First of all, initially the COVID platform had some difficulty. So now, of course, the platform is more robust and more user-friendly it is made. Second is that we should also have non-registered people able to come and take vaccine, because especially poor migrant laborers kind of people, or those who are not very well off and may not have cell phone, etc., there may be difficulty in registering. So without registration also they should be allowed. Of course, their details can be taken and entered so that we have a record. So that is first. Second is we have to motivate the parents. Children don't come for vaccine directly, so parents will bring them. So parents have to be motivated, convinced to bring children to vaccine. Third is proper counseling, so that whatever side effects they are going to happen, some will happen, fever, mild redness, tenderness, not able to move the arm, etc., are taken care of because of the proper explanation given to them, and they don't panic.
Is vulnerable population are still waiting for their first or second dose of vaccine. So is there any injustice to them as we are starting or thinking for child vaccination?
Yes, I think this is a very important question you have raised. Thank you for that. As the more vulnerable older people are still waiting and have not got their full vaccination, we first should prioritize the vulnerable people, because the main purpose of the vaccine now is to stop morbidity and mortality. And that is high in the older age group. So we should first saturate or cover all the vulnerable and older people, and then only start child vaccination. And within also child vaccination, some countries, as they have done, they are not vaccinating all children, but within children, those who are again vulnerable, obese, diabetes, other heart problems, or others who may develop difficulty if they get the disease, they are first vaccinated. And then, depending upon supply, as we get more and more supply, we can vaccinate adults, children also. The other strategy some people have suggested is the Zydus Cadila vaccine is the one which can be only given to children. So that can be reserved for children, and rest of the vaccine which are yet not approved, so that can be given to adults. But the Zydus Cadila vaccine should not be given to adults. It can be only given to children because that is approved. So that could be another way of solving this difficult issue.
Yes, sir. Okay, sir. Thank you. Thank you so much, sir.
Thank you.
Thank you, Dr. Dilip Mavlankar, sir, for sharing your valuable opinions and enlightening us on this still debatable topic, COVID-19 vaccination in children. And I'm sure this session will be helpful for parents to reduce their hesitancy and fears about vaccination against COVID-19.